Welcome back to NTV's Goodlife. I'm at the Schrock Medical Clinic with Dr. Schrock himself. Good morning, doctor. How are you?
Good morning. Good. How are you?
I am doing very well. We're talking about something that I honestly have never really heard of, IV nutrition therapy. Exactly what is this?
Yeah. Well, it's instead of taking vitamins orally, you can do it through an IV. And there's a few benefits in that. It bypasses your digestive system, so your body uses those vitamins in a little different and at times better way because they're bypassing part of that digestive metabolic process.
So what is exactly in this nutrition therapy?
Well, there's different forms that you can do. You know, we've got a form of IV therapy that's really good for female problems, that hot flashes to just bad menstrual cramps and those type of things like that. And it's very helpful to have the right nutrients in there because your body does and works a little better during those times. It also is very helpful with the headaches that can be associated with a lot of particularly menstrual cramps and at that time of a woman's cycle. We're also doing a recovery as one of our products that we use, which is chock full of different types of vitamins. So the B vitamins, C, amino acids. It's even got something called glutathione on there, which is a super antioxidant that helps your body fight cellular breakdown and actually boost parts of your immune system. So that's one of the big things that we're really, particularly this time of year when it comes into the cold and the flu season like that, you know, we never want to say that this is going to prevent any of those type of things. But what we know is that the healthier your body is going into any type of disease or an infection process or whatever it is, the more ability you have to fight it off. So we want to keep that immune system ramped up as high as it can be at all times.
Now, can anybody do this then, or does a doctor need to say, I think you need?
That's what when you come in here, we have our nurse practitioner or our PA evaluate you and see what your need is, you know, what would work, what won't work for you basically. So yeah, there's a medical assessment that goes along with it. Because most of these things are pretty harmless, but by the same token, you want to make sure that it's checked out thoroughly so we're not doing something that could really cause somebody problems. And we can do blood work if we need to find really some of those levels that are depleted. And so we've really got a good way of checking it out and making sure it's right for the person as well as safe.
How long does this procedure take?
Anywhere from about an hour to, it depends on the person. Like when I get it, we can dump it in fairly fast. I don't get nauseous or anything like that. So I can dump it in about 20 to 30 minutes. So
well, I was just going to ask you if there's any side effects to this.
Yeah, some of the worst case scenarios that you see is sometimes people get a little bit nauseous from it. Well, usually when that's the case, you just slow down the drip rate on it basically because it's not just the vitamins. We're also using about 500 milliliters of saline, so it's a great hydration tool as well. So how we really like to see it used best is over about a 3-week cycle where the person comes in twice a week. So you get about 6 treatments in a 3-week time period. And it helps hydrate you, it helps ramp up your immune system, helps your body recover. And then on the follow-up side of that, you know, we've just got some great nutritional supplements you can take orally, you know, that really work, particularly when you talk about boosting the immune system, you know. And I mean, you can Google right now zinc and D3 and vitamin C, and you're going to see publications from PubMed to WebMD that there's really a lot of research been done in this field. First of all, we know that when you're zinc deficient, when you're vitamin D deficient, and those type of things, your immune system is just naturally dropped. You know, we're seeing a lot of research building, and nobody's really wanting to put their finger on it, but we're seeing a lot of times, you know, with zinc and vitamin D3, where you can reduce the length of a cold, let's say, by about a third. They're really looking into, because what we're wanting to see is, can we be preventative? You know, maybe not preventative that you don't get it, but preventative to the extent that if your immune system is ramped up enough, you don't even perceive that you get the virus because your body is fighting so well.
Wow. Okay. You have a little more time. We have a lot more Dr. Schrock when we come back. We'll be right back.